Upper and lower eyelid blepharoplasty aftercare. So, as always, we start with the gray folder, the evaluations in the office. Afterwards, there's the aftercare instructions, which I'll go over in detail with you, both at the time of the consult, the time of the pre-op evaluation, and my nurse does a day of surgery, and then we remind you on the phone. Now, most patients have some level of dry eyes after surgery. I encourage you to use artificial tears to keep comfortable. The first week, the first 3 days, it's crucial to ice. Cool compresses in the form of frozen peas in a Ziploc bag, alternating covering both eyes. You will be able to see immediately after surgery. There are no patches that are put on after surgery. Go home. The next day, most people are pretty swollen. If you run a race, usually the next day your legs are pretty sore. Same thing here. The next day after surgery, they're a little bit swollen. They're a little bit sore. So generally speaking, I like to have you use ice compresses in the form of frozen peas every hour while awake for 15 minutes of every hour for the first 3 days. That's a lot of homework, but there's plenty of time to do reading, watching TV, or being on the computer anytime in between that time. If you're sleeping, no need for any frozen peas. Antibiotic ointment, which I prescribe to you, that's an ophthalmic ointment, would go over the suture line, the line of stitches, 3 times a day. If there are stitches on the lower eyelids, same thing. Most of the time on the lower eyelid, I'm making an incision on the inside of the eyelid to hide any form of scar, as scar prevention is very important to me. Then you might get a drop to put in the eye of antibiotic 3 times a day as well. I like you to sleep or lay with your head higher than your heart, head elevated 30 degrees with 2 to 3 pillows so that the flow of gravity can bring the swelling downward. One would expect swelling and bruising for 5 to 7 days after surgery. Now, some people can heal a little bit slower and can take longer with the bruising or the swelling, but we see here this lovely woman 3 days after surgery has some bruising. Now, the bruising tends to start off blue, then purple, then phases into yellowish, green, brown, and then it goes away. Obviously, you can wear makeup to camouflage it. If a CO2 laser is used at the time of surgery, we have to wait for the skin to reform over it, generally about 3 or 4 days. But cover-up or makeup can be used afterwards. Sunscreen as well when we go outside, and obviously you can hide everything by wearing a nice pair of sunglasses.